Hey guys, it's Miss Weems. So now that we're at a point where the governor just said today we have to shelter in place, I'm going to give you your notes and please check your mind and let me know what you think so I know how you guys want to proceed. Okay? All right, so today we're going to talk about treatment of psychological disorders, and I'm going to start with the psychodynamic perspective. Okay? So we talked about Philip Pinel before, that he wanted to do a more humane approach to mental health treatment instead of drilling holes in people's heads and locking them in containers. And Dorothea Dix was another person who really promoted a more ethical and humane approach to mental health care. Since the 1950s, drug therapy and community-based treatment programs have eliminated the need for most mental hospitals. Most hospitals have a floor that they use for mental health treatment, which is usually for people who are not on their medication and need to be, or having negative impact from their medication and need to be brought into a more calm level. But we really don't have many solely hospitals that are solely for the purpose of mental health treatment anymore, because with medication and community-based treatment, we don't need them. So there are two categories for therapy: psychotherapy and biomedical therapy. So psychotherapy, you have a therapist who uses psychological techniques to assist someone in trying to overcome difficulties to achieve their growth. They're walking you through, they're talking you through it, they're helping you grow. Biomedical is using either medication or sometimes surgery or other medical treatments to work towards handling a disorder. Most therapists use the eclectic approach, which means they mix the two. There's a little bit of therapy, there's a little bit of biomedical intervention, but they use both. But since the 50s, we've had medication. Okay, so psychoanalysis. This is one of our early attempts at mental health therapy, psychotherapy. So I'm not saying it's the best, I'm saying it's the first. Okay, so again, Freud believed that people would be healthier and less anxious if they weren't dedicating so much of their energy to the battle between the id, the ego, and the superego. Okay? So remember, your id is the inner toddler, the 2 or 3-year-old who has no impulse control and just wants it now, and he wants it and he wants it, temper tantrum. Your superego is your Clark Kent, your perfect, response in the most ideal scenario, the best version of you. And your ego is the one in between, trying to manage reality and balance these two desires. So Freud believed that through free association, which we've talked about before, resistances, dreams, and transference kind of revealed previously repressed feelings and allow people to gain some self-insight. So remember, we talked about free association. If I say ball and you say kick, that's totally normal. You'd start very even, small, like ball, kick, Christmas, tree, outside, sun. And then if you said mom and somebody said evil, you've got a pairing. Okay? So that's free association. And again, Freud did dream analysis. Transference would be like when you put your feelings for one person onto another. All of those things that we've talked about before. Okay? And again, Freud really pushed the power of your childhood experiences into how it influences you as an adult. Okay, so let's talk about psychoanalysis. So free association, I just did that. Speak whatever pops into your head. So how you choose to edit stories, when you choose to change the subject, when you tell jokes instead of answering the question, are all examples of resistance. If somebody says, well, you look pretty today, and you're like, huh, you should have seen me yesterday. Why are you deflecting the compliment? It kind of gives some ideas as to why people respond the way they do. Okay? So a psychoanalyst would notice your free associations and the things that you resist talking about and interpret that. So they give you what they believe to be the meaning behind your behavior. Okay? Over time, some people develop strong feelings, positive or negative, towards their therapist, and this is called transference. So they might feel really positively towards them, or they might really hate them. So they could be moving their feelings from family or other important people and directing them towards their therapist. This can provide a lot of insight into someone's relationships. Psychoanalysis is rarely offered now because it is not supported by any scientific research. And This method of therapy takes years and years and years and lots of money, and people don't have time to suffer with their issues for that long. Okay, so let's talk about psychodynamic. This is the updated version of Freud, okay? So we don't talk about the id, the ego, or your superego. And you meet with a patient face to face, no one's laying on a couch. So to go back here, no one's laying on a couch. You sit up and you talk to your therapist, okay? So they're going to focus on themes across your important relationships, your childhood experiences, and your therapist relationship. So you meet once or twice a week rather than almost every day, which is what Freud preferred, and only lasts for usually a few months. And they're looking at a theme. If you're like, hey, you're not very happy with your luck at finding a successful relationship, but you notice you didn't have a great relationship with your parents, you don't have a lot of close friendships, and we're seeing a pattern in what you were pursuing, okay? So they help patients gain perspective into the thoughts that they're avoiding. So why they don't say I love you, or why are they so defensive about everything? So psychodynamic focuses on the defense against the anger and why someone is angry. It's an interpersonal psychotherapy, which means you're going to focus on your current relationships and improving those relationships. So we're not so obsessed about any issues with parents so much as, well, yes, you have this issue and it's impacting your current life. So let's deal with how it's impacting your current life. Okay. Also, on Google Classroom, there's a crash course on psychotherapy. I suggest you look over it. Okay. Please check your mind. Let me know what you guys think about whether or not you still want to do the serial killer project or if you want to move forward. Also, I explained the county wants us to give you guys a break, which I think you very much deserve. So I'm going to post notes for the rest of this week, and I'm going to stop. And again, there's no assignment. It's just going to be notes. You can mess with them now or you can mess with them later, whichever your comfort level. But grades have to be in by the end of this week. So if you owe me any makeup work from this hiatus from actually seeing me in person, you need to turn in by the end of this week. And let me think. Yeah, let me know, because schools start up again, quote unquote, on the 14th. Not in school, but online. And I want to know, do you guys want to do the serial killer project? Because we still have time for it in our pacing, or do you want me to skip it and go straight into review? So let me know what you think. Message me on Remind. Email me if you have any issues. And I miss you guys. Bye.